Good morning. We've got a quorum already, so may I now call the meeting to order. Item 1 on the agenda, information papers issued since the last meeting. We haven't got any. Items for discussion at the next meeting. Members, please refer to the list of outstanding items for discussion and also the list of follow-up actions. The next meeting will be held at 10:45 on the 9th of March. And we've two items have been proposed: promoting active aging and review of the disability allowance. Any comments, Deputy Chairman? I have recently met the HKCSS. Now, I want to say that for item 3 today, there will not be deputations coming, and HKCSS has asked us to conduct a public hearing on the proposed pilot scheme on residential care service vouchers for the elderly. So I wonder if members agree that we should have a public hearing for that. Thank you. I entirely agree with the Deputy Chairman. But then we may not have enough time on the 9th of March. So I would suggest that we should hold a special meeting so that we can have more time to discuss the matter. But then, as you know, we really don't have enough slots. And I don't think we will have sufficient time on the 9th of March, even if we have a longer than usual meeting. Mr. Fernando Zhang. I want the administration to give us definitive replies on the pilot scheme. So, Chairman, I support the idea of a special meeting. We can discuss the matter in great detail, and we can also meet deputations. It's true that we do not particularly like special or additional meetings, but I think a special meeting on this is needed. Mr. Leung Yu Chong, concerning the review of the disability allowance, will we be meeting deputations? No, but I think we should give the deputations an opportunity to give their views to us. Now, in fact, members also have a lot of views on the disability allowance, and I don't think an hour or so will be enough. So if you want a public hearing on the disability allowance, I think we'll need a special meeting, because if they come, we should respect their right to address us, and so we will need a special meeting. I don't think we should just give them 3 minutes. Deputy Chairman, I have received some cases, and I have decided that they should not be forwarded to the panel for discussion. Instead, we should have case conferences. So perhaps we should really consider this matter very carefully. People or the deputations come they travel a long distance, a long way to come, only to be given 3 minutes, and that's really that really makes me feel very uncomfortable and sad. Sometimes after we've spoken for one round for a few minutes, we feel that we haven't really fully expressed our views. So can we have one item or one agenda item for each meeting instead of 2 or 3? Now, because if we have 2 or 3 items on the agenda every time, we can only we can't discuss those issues in depth, and then the administration will feel very happy and it will say that, oh, the panel has already been consulted. But then there are items that members want to discuss, and there are items that the administration wants us to discuss. And so I think we should only have at most 2 items for each meeting. But then for more important or controversial items, maybe we'll need a dedicated meeting. So, all right. That's going to be the arrangement on the 9th of March. And I'll ask the Secretariat to arrange a special meeting to discuss the pilot scheme on residential care service vouchers for the elderly. But then, Chairman, I'll be in Beijing from the 3rd of March. But then you just go ahead. The panel can still go ahead with the special meeting. All right. As far as possible, we'll try to accommodate all members' schedules. So now, please invite the administration in. Item 3 on the agenda: setting up a new contract residential care home for the elderly in the public rental housing development at Fultan Shatin Areas 16 and 58D. We've got paper CB2 770/03 and also paper CB2 770/04. They have already been issued to members. And I want to remind members that they should note the declaration of interest requirements under 38A of the ROP. At the meeting of the panel, members must not move any motion or amendment to a motion if he has a direct or indirect pecuniary interest, and if he wants to speak on the item, he must declare his interest beforehand. And so may I remind members that if they have direct or indirect pecuniary interest on the matter being discussed, they should disclose the nature of their interest before they speak. We have with us today Mrs. Eleanor Chan, PAS for Labour and Welfare. Then Ms. Cecilia Lee, Assistant Director of Social Welfare, responsible for elderly services, and Mr. Kenneth Wu, CEO, Subventions and Planning, SWD. So can I now invite the administration to take us through the paper? Yes, thank you, Chairman. Thank you very much. Let me briefly introduce the project to you. Now, in fact, the site used to be the Fultan Cottage area, and there will be a PRH development. The population will be about 13,000, and over 4,000, or rather 4,850 domestic flats can be provided. And for this contract home, there will be 100 places, out of which 60 will be subsidized places. In fact, since 2001, SWD has awarded contracts through open tenders to NGOs or private operators in respect of 26 purpose-built RCHEs. And for 2 of them, fitting out works are going on, and so 24 have already been commissioned. And about 1,800 places are subsidized places. Some of these homes also house daycare units for the elderly, DCUs. The housing department will be responsible for the design. So the construction of the premises will tie in with the construction schedule of the public housing estate. We believe that the RCH will be scheduled for completion in around 2019, and the funding will come from the Lotteries Fund. The Director of Social Welfare and the Financial Secretary after having sought the endorsement of the Lotteries Fund Advisory Committee, can use the funding to support social welfare development, including the construction of these contract homes.
However, if the additional recurrent financial implications exceed $10 million per annum, we have to seek the approval of the Finance Committee. The construction cost will be around $31.3 million, and the recurrent expenditure, including personal emoluments and our government rent, will be over $10 million. Is in fact $13.4 million. So we'd like to draw members' attention to this. For previous PRH developments, we usually consult district councils. So in September, October 2013 and May 2014, this project was discussed by some committees of the Shatin District Council, and they have no objection to this development incorporating welfare facilities. Thank you. Thank you. I now open the floor to members for questions. I read out the order now. Deputy Chairman, Madam Chen Yun, Han Leung Chi Cheng, Pan Xiaoping, and Dr. Fernando Zhang, 4 minutes each, please. Deputy Chairman, I was about to ask for more. Chairman, first, I have no objection to the project because 100 places will be provided. Given that Fulton is not really a new area, I believe the elderly population will be rising, so will 100 places be enough? Shatin has a long history of development, and the population is definitely aging. So have you considered the need of the community? And I'd like to know whether this site will be for a PRH project, or whether it is whatever kind of subsidized housing the area is going to be used for. Some of the flats will be for rent and some for sale. You have to make it very clear in your terms or in your lease. Otherwise, future buyers may not like this facility. Whenever there is a new site, you have to specify clearly in the lease. I'd like to know whether you have considered the following. First, the number of places, whether it is too small, and secondly, have you made clear in the lease? An amount, there's 100 places. Do you have any beds for short-term respite services for elderlies when their family members are not available to take care of them? I think this should be made a regular item in the government's plan. Thank you. Thank you for your questions, Madam Chen. Yes, in Shatin, we do consider the needs of the community. We have a contract RCHE in Taiwan already commissioned. And please note Annex 3, among the 12 sites available for RCHEs, 3 are in Shatin. And Ms. Chen asked whether there will be respite places here. In all new RCHEs, we will direct that a certain number of respite places be made available. This is a new measure. We already provided for that. What about increasing number of places or more places? As I mentioned, in Annex 3, you can see a list of new RCHEs. No, my focus is this site is very valuable. There will be 4,000 people living there. Can you build a bigger home? Okay. Or which one from the administration? Thank you, Madam Chen, for your view. In all PRH developments, we reserve space for social affairs facilities on the basis of the population of the needs. You may think that 100 places is too little, but we have to consider housing needs as well. And this will not be the only RCHE in Shatin. As can be seen in Annex 3, there are 3 other sites available in Shatin. Where it is suitable, we will reserve more sites. We used to say that there were 11 sites, but now we have increased that to 12. So in the time to come, we will continue to secure sites for RCHEs. Mr. Leung Chee-Ka, we must support this project because, as we all know, we have an acute shortage of RCHE places. But I do share Madam Chen Yan-Han's view. Given that this is a new site or new development, can't you provide more places? Perhaps it's a bit too late to say this now, but when you have RCHEs in new PRH developments, please increase the number of places to be provided so that you can catch up with the demand. And as we can see, that aging is getting more serious in the community. You must be forward-looking enough in your planning. Otherwise, 10, 20 years down the road, you will never be able to catch up. And I have asked the following question on various occasions. I've put that to the Secretary, but I put this to the administration today again. As a matter of policy, the recurrent expenditure will be about $13.4 million per annum. This has to be approved by LegCo. We must have enough manpower. You have 60 subsidized places and 40 non-subsidized places. You must have sufficient personnel, and you have to ensure that the contractor can have enough care workers. How can you assure me? Because you are building other RCHEs as well. Are we training enough manpower for this sector? Assistant Director. Thank you. Thank you, Mr. Leung, for your question. Regarding the number of places, we do understand in each new development we will maximize the potential. We plan to provide 100 places. By the time renovation is completed or decoration is completed, perhaps there can be a leeway for providing a little bit more. We planned to provide 150 residential places plus some daycare centers and then other Shatin RCHE. And yes, we do care about manpower. Whether we're talking about nurses or frontline personal care workers, we make use of our usual training methods, and we're trying to attract new blood, such as young people, to join the sector. Members might have heard of a pilot scheme to attract younger people. They will be recruited first, and they will receive training on job, so that they will be mentored in an RCHE, so that they can understand the operation of one. So while they receive training, they can see promotional or job prospect. We hope that this can be an incentive for young people to join the sector. As said in the policy address, we will have about 100 places, such training places in the pipeline. And in the long term, we should also see what more can be done in terms of manpower planning. Thank you. Mr. Pan Xiaoping. Thank you, Chairman. Of course, it's hard to say no to such a development. However, I do echo Mr. Leung Chi-Cheng's concern, and that is the need for manpower through training, and you want to attract more people to join the sector. I understand that people talk about importation of labor for this sector. That would certainly affect training and development of this industry as a result. Annex 3 says that 12 sites are earmarked for RCHEs. Looking at these 12 sites, well, most of them provide 100 or 150 per site. But what about the site at Anderson Road, Kwun Tong? While planning is still in progress, can you provide more places here? What is the progress of these 12 sites? Will you further adjust the number of places to be provided in each project? Mrs. Chen, or rather, Mr. Wu. Thank you. Regarding the RCHE on Anderson Road, Kwun Tong, we already consulted the council and received funding support from FC in January using a lottery fund. The project would start early this year, planned for completion in 2018-19. All right, that's 2019. What about the progress of other sites? Is progress good? For all other items, for those with funding already earmarked, works are in progress. Thank you. Dr. Fernando Zhang, of course, we will certainly support this paper given the severe shortage of places. But every time when we approve the construction of an RCHE, I tend to think that elderly persons do not just need residential services or daycare services or home care. There should be a continuum of services. If it is the government's policy to promote aging in place as the core and institutional care as backup, then because the current way of resource deployment is very fragmented. For instance, when a site is available, contract RCHE will be out for bidding, and people wait in the waiting list. In fact, residential services and daycare and family care is a continuum. If we consider it this way, then our mode of thinking will be entirely different. We should not, when there is a need, you go through an assessment. If you are eligible, you are on the waiting list, and when you finally get a place, excellent. Before that, perhaps see whether you can have daycare services. If not, you stay home, and if you can afford a domestic helper, very good. Otherwise, you are on your own. Because services are very fragmented, people queue up for different kinds of services on different waiting lists. There is no communication among different types of services. Now, if we want to avoid institutionalization, then we should enhance community support services. I don't know when. I don't know whether this is more to do with our policy on elderly services. Yes, we support new RCHEs, but if you continue to do it in this fragmented way, you can never catch up with the needs. You must have a strategy.
I understand that there will be a pilot scheme on residential care service vouchers. But then, as Deputy Chairman has pointed out, there will be over 4,000 PRH flats in that public housing estate. And before, elderly persons need to go into RCHEs, they need daycare centers. So, in fact, in other words, they need a continuum of service. And so when you do your planning, you can't do it on a fragmented or on a piecemeal basis. Yes, Chairman, thank you. We are here to seek funding for the hardware, so we must provide the hardware. This is important. And I understand that the physical conditions and the health of elderly persons deteriorate gradually. So initially they may still be able to age in place, but then later they may need more care and support from their families, and ultimately they may need to go into RCHEs. In fact, we have a caseworker to follow up on the situation of the elderly person concerned, and the worker will try to identify the most suitable service for the elderly. And I think it's important that we do more, both in terms of hardware and software, concerning provision of residential places and also more DCUs and daycare centers. I think members know that, in fact, we are always approaching members for support to provide the hardware. Mr. Leong Kok Hong. Now, I think it's very simple. Now, if an elderly person is diagnosed by a doctor to be in need of residential care service, then the government should provide this elderly person with a place. So, how many more such places do we need? Now, at the moment, the government adopts this strategy. If you can't provide enough residential places for needy elderly persons, you ask them to go to DCUs or daycare centers for the elderly, or you try to ask them to age in place. You told us that there would be a worker to identify the most suitable service for an elderly person. Now, you know, we have 3 tiers: residential care home for the elderly, daycare units or daycare centers, and then aging in place. Now, what if the worker, in his professional judgment, feels that the elderly person must go to an RCHE? You may not be able to provide a place for this elderly person immediately. So you are not giving the elderly person concerned the best service based on the assessment done by a professional. I understand that at the moment, you are reserving a certain ratio or proportion of PRH units for elderly persons. But then we demanded 8:2, and you only agreed to 6:4. So you are reluctant to listen to the views of or the feedback of the service users, and you do not attach great importance to the professional assessment done by the workers on the conditions of the elderly persons. So this paper is on hardware. And you said software was also important. I think it's simple. You just be better to these young people so as to attract them to join the field. Now, say if I want my son to be a scientist, can I, and I want to encourage him to be a scientist, can I disallow him from reading science fiction or science-related books? Can I do so by allowing him no idle time? If you, I understand that you are bringing in people from outside, and these people can go back to their home villages after 3 years of work in Hong Kong and construct their own houses. So I think when you keep on bringing in these people, wages will not go up in the sector. So I want to know whether the so-called workers do pay home visits to the elderly. I want to know the system, but I think time's up for this round for you. And I want to ask the administration this question. And there will be 100 places. The ratio is 6:4, 60 subsidized places, 40 non-subsidized places. And may I refer to Annex 2 of this paper? In Sham Shui Po and in Tsuen Wan, the ratio is 8:2. 80% subsidized places, 20% non-subsidized places. So why is it that in Fo Tan, the ratio is 6:4 instead of 8:2? We have said many times that we want 8:2 or 7:3. I understand that I'll say in Tsuen Wan, the ratio is 8:2. So why is it that in Fo Tan it's again 6:4? I think the provision of 100 places only is not in line with the principle of cost effectiveness. I think you should provide 200 or 300 places. That will be far more cost effective. In your Annex 3, out of the 12 projects, only in Shek Mun will we see more places, 150. For the other projects, there will only be 100 places. So why is it that you're not planning on a basis of 200 or more places? What are the difficulties? Who can give a reply, please? Ms. Lee. Yes, thank you, Chairman. When we plan new contract homes, we normally adopt the 6:4 ratio for subsidized to non-subsidized places. And we also take into account the location of the contract home, the population profile, the social situation. Now in Sham Shui Po, we used to have contract homes with a ratio of 8:2. In Shatin, A total of 4 contract homes have been commissioned or will be commissioned in the near future. I would like to tell members that upon the advice of the DOJ, we will, in the contracts, add a provision allowing the administration the flexibility to change the ratio between subsidized and non-subsidized places. So we will closely monitor the take-up rate of non-subsidized places. We'll look at other relevant factors, and we can flexibly change the ratio. So I want to say that normally we adopt the 6:4 ratio. Sorry, I want to interrupt, but then concerning the second question, you can answer that later. Now, because the 70% to 80% of the places are for the grassroots, you can see that most of those queuing up for subsidized places are elderly persons on CSSA. I want to say that non-subsidized places are also very popular. They are taken up very quickly. So I don't think you will increase the ratio of subsidized places because of poor take-up rate of non-subsidized places. All right, I'll have to draw a line after several members have asked their questions in the second round. 2 minutes, Deputy Chairman first. 2 minutes is simply not enough, sorry. Now, I think you can build 1 or 2 extra stories for this building. And secondly, I think you should be able to provide occasional care service in the daytime. Do you know that in the we like the home for the elderly in Northeast NT very much because there are sitting out areas, and the elderly persons like to spend their time there. And then Shatin Areas, it's a very big estate. How come the RCHE there will not house a daycare center? Shatin Areas is going to be a very big estate. And how come you're only proposing to provide 100 places there? Now, the government should not only be concerned about providing as many PRH flats as possible. Elderly persons also need accommodation. They need residential care homes. And in fact, if you can help the elderly persons, you are in fact also helping their family members. I know time's up. 2 minutes is really not enough. I think there should be sitting out areas for elderly persons. And for the 12 sites, I'm worried that they may fix the ratio and also the number of places at a very early stage. Yes, I agree that we should have RCHEs in different districts to suit the needs of different people. But then you should provide more places, build 1 or 2 more stories. Shatin Areas estate is such a big estate. How come we are only going to have 100 places? It's still not too late. we should discuss this policy in detail. We shouldn't waste taxpayers' money. We are not being too idealistic. We need different types of services, some daycare services, some occasional care services, some RCHE services. All right. I hope you've jotted down the Deputy Chairman's questions, and I think you can answer after all the members have asked their questions.
Dr. Fernando, I'll try to be as succinct as possible. So, for this development, it is not a standalone building. It is subsumed into a PRH development. I believe it's on the ground floor, the first floor, 2-story. This is something good. We've always said that all PRH estates should have this kind of planning. It should not just come once in the blue moon. So you are finally doing it is something good. And of course, this is not just confined to RCHEs. The same applies to other social welfare facilities. And the commissioning date is 2019. Population intake for the whole PRH is 2010, and yet the RCHE can only be commissioned in 2010, a gap of 1 year. How come there is this gap of 1 year? Shouldn't you have planned for it earlier so that the user or the contractor can have input on the design of the RCHE as well, and then the site doesn't have to be left idle for a year? I note that here there is no daycare services here, daycare centers here. If you can have it, then services will be more continuous. If there can be services for elders in the community and living at home, it will be better. So I'd like to know whether you have considered this, because it is not obvious from the paper. Can you address the questions later? Annex 3, you say that there is a DCU with 60 places. Mr. Lang Ko Hong, a DE of 60 places. I think we are too stupid, because they have only got that much budget for social welfare, and we are pressing the administration. This is not just about 100 places. There has to be recurrent financial implications, manpower, and other thing. If the scale is bigger, they don't have manpower to man the RCHE. So I think the administration doesn't want to improve services for the elderly. In other words, they don't want to spend more in this area. The budget will be announced soon, and John Zhang has asked for $230 billion in a future fund. Now, for money squandered in white elephant projects, if some of them can be put back to this area, the problem is solved. So this is not just about shortage of space. That's why they want to put the ratio at 6:4. That's why they only provide 100 places. You scold Mr. Matthew Cheung, yet he dares not take it up with C.Y. Leung. Do you think that you don't really have enough space? Don't be so foolish. Well, it doesn't matter if they are going to have 1 or 2 more stories, but who is going to foot the bill for additional recurrent expenditure? And the message is simple. If you are poor, I'm sorry, you continue to wait. If you can afford it, you can live in non-subsidized places. For full-time, the ratio is 6:4. As a result, the middle class are scolding the administration because they have to place their elders in non-subsidized places, and they are paying extra for international schooling for their children and so forth. Yes, Mr. Lang, I think we know this. Mr. Administration, please respond. Yes, I'll do it very quickly. I think Ms. Chen Yuhan can rest assured this is within a PRH development. There is bound to be open space and greening in the vicinity. And in future design, we will try very best to provide a pleasant environment for the elders. And in a past contract RCHs, we usually placed them in a quiet neighborhood. And even if it is in a busy area in town, we will try to place the RCH further away from traffic noise, for instance. Social welfare facilities in PRH developments. Right from the beginning of the planning, we will try to include social welfare facilities, not just for the elderly, but for women and for children as well, for the whole family. So what I have here is just for elderly services. But in fact, in PRH developments, we have other social welfare facilities. Dr. Van asked about the time of completion. In fact, for 2019, it's just mere completion. The site will be handed to us. It's just a bare shell premises. After inspection and so on and so forth, decoration will start, and we're trying to shorten the time for making the site ready. We have 60 places. It is called daycare centers. There will be 60 places for daycare, though it's not mentioned in the paper. And as for resources, I think as members know, every year we are adding resources for residential care services and daycare services, and also support for carers. So members, please do understand that we are not sincere in taking care of the elderly. We are working very hard. Okay. They are going to the FC for funding approval. I'd like to ask members whether we have no objection to the paper in principle. Any objection, please? Chairman, I have no objection, but I'd just like to mention one point. Now, I am not pressurizing you. I support you, but before that, you have to tell me whether you're going to change the arrangements for these 12 sites. I know these sites well. They are very big. How come you are only going to provide 100 places in Shatin? Now, I am not pressurizing you, but I don't want to just consider 100 places in OFC papers. It's a waste of public money, and people are waiting for a long time. So these are my conditions. You should press the SWD. You have to consider views of legislators. It's a waste of money. You only add 1 or 2 floors in each project to provide more places. Before you go to FC, I hope you can give me a paper. I support this project, but I know you are in a difficult position. You face the strong call for housing. All right, in your FC paper, please give us a revised Annex 3 containing the 12 sites. Tell us whether any of them are standalone buildings or are incorporated in PRH development. I think if it is in the PRH development, it's not so difficult for you to get another 8 or 10 units to enlarge the RCHE in question. If we can have a list, then we can help you to ask for more units from the housing department. Now, if the layout plan is already drawn, or if you already tendered out the projects, it may be a bit difficult. Have you been to Meitong Estate? Just next to Kai Tak. we believe that the units there block the ventilation breezeway, so we urge the administration to provide more space at grade. So you tell the housing department we are asking more units for people as well. The elderly persons are also human beings. You can use some ways and means to change the position or mindset of the administration so that you can do a better job. Well, if they refuse to do so, then at the anniversary celebration of FTU, they should not invite Matthew Zhang. Well, that's your own remarks. All right, we move on to the next item. Revision of fees under the adoption ordinance. Members have got the papers. Please invite the administration to join us now. For this item, we have Ms. Xie Wingman, PAS for Labor and Welfare from the Labor and Welfare Bureau, and also Mr. Feng Man Chong, Assistant Director of Social Welfare, responsible for Family and Child Welfare.
或者政府嘅代表
Yes. Because we've overrun a bit, Ms. Xie or Mr. Feng, please. Thank you. Chairman, I'd like to brief members on the paper. Adoption is a statutory procedure for a permanent transfer of the rights and obligation of parents to another person. In Hong Kong, we're talking a minor who is younger than 18 years old, and we have Cap 290, the adoption ordinance, and also the convention adoption rules, Cap 290D, governing this. Well, under the two ordinances, the Director of Social Welfare will be appointed as the guardian ad litem, or GAL, of the infant in an adoption application, and the applicant will have to pay for the GAL fees. And under the two pieces of legislation, the current fee is 2,840. Now, we don't want to make the fees too high, so much so that it would be a deterrent. So the Director of Social Welfare has decided to cover the 20% of the cost. According to a recent review, the fees are not really recovering 20% of the full cost, which is 3,970. So we propose two options here. Under A, starting from the 1st of June 2019, the fees should be increased from 2,840 to 3,970. And option B is to increase the fees by about 12% in each of 3 consecutive years starting from June 2015, so that the fee will finally reach 3,970. For both options, the increase is moderate and shouldn't be a deterrent for applicants. We've also consulted people who are minded to adopt a child, and also service providers. They have no strong views. If option 8 is adopted, then we believe that there will be an additional annual revenue of $134,470. And for option B, the additional revenue for the government will be $39,270 for the first year, $45,220 the second year, and $49,980 for the third year. So we'd like to consult members on which option to adopt. All right, we'll start our discussion. Mr. Chen Chi-chun and Mr. Pan Xiu-ping and Dr. Fernando Zhang.
Mr. Chen Chi-chun, 4 minutes. Thank you, Chairman. I don't think members were very strong views about the proposed adjustment. And according to the administration, even under option A, we're only talking about an additional $130,000. And I don't think a person who wants to adopt a child will change his or her mind because of the additional $1,000 odd. But I want to talk about the principle of cost recovery. Now, for business or commercial activities, for people who do things that will benefit themselves, of course, I have no objection to adopting the principle of cost recovery. But then the act of adoption benefits other people, and should we apply the cost recovery principle here? Now, people donate blood. Do you need to adopt the cost recovery principle for blood donation services? And I think there should be a review of the adoption policy or the eligibility criteria. So will there be a review with a view to relax the prerequisites? For example, at the moment, only those who've got married for over 3 years can adopt children. So will this be relaxed? I would like to know how many children are waiting for adoption and how many are waiting to adopt children. And if you ask me which option I prefer, I would prefer option B because the increase will be gradual and incremental. And I think these parents, in fact, want to do things that will benefit society, and I don't think the cost recovery principle should apply to them. All right, adoption figures, whether there will be a review, whether the eligibility criteria will be relaxed. Yes, Mr. Fong? Chairman, thank you. Mr. Chan is correct. We adopt very stringent eligibility criteria because we need to take into account the best interests of the children concerned, and so we have to make sure that the parents are suitable persons. They have the lifelong commitment. And they will take good care of the children. And so we are of the view that the present eligibility criteria are suitable. In the past 5 years, on the average, there were 119 applications for adoption per annum. And we had about 200 odd children waiting for adoption every year. But then for some cases, the investigation may take longer. For example, the children are over 3 years old. They have some health problems, and so on and so forth. But then for children of good health, the matching process may only take 3 months. And we are of the view that the present procedures are operating well. So can you tell us whether there will be a review, or and if so, when? Chairman, I've already outlined the reasons. We will closely monitor the development in society, and we will carry out a comprehensive review when the need arises. I want to know whether the eligibility criteria are merely policies, or are they written down in the law? There are some requirements in the law, Chairman, but we also have a code of practice or code of conduct, and our paramount concern is the interests of the children concerned. So can you tell us which of the criteria are legal requirements and which of them are only policies in your code of conduct or code of practice? Yes, perhaps you and Mr. Chan can exchange views when you two have afternoon tea together. Mr. Poon. So we were told that in the past years there were about over 200 children waiting for adoption per year, and the number of applications was on the average about 119 per year. So how can we try to promote the act of adoption in society? Is it that the number of adoption cases or applications has remained stable over the years? And then concerning 20% recovery of the full cost, I want to know whether this has to be rigidly applied or whether there can be flexibility in applying this percentage. And then we have been presented with two options, option A and option B. So can I know whether the administration has any preference among the two options? Yes, Mr. Chair. I thank the member for his comment. Chairman, we think both options are feasible, and so in fact we are sincere in seeking members' views on the two options. And then Mr. Fong can say something about the 20%. In fact, we wish to strike the right balance. We do not want the fee to be too high as to deter people from making applications. But at the same time, we need to recover some of the cost. I want to know whether this 20% has to be rigidly applied. Is there any room for maneuver? Is this the norm? Is this the government's policy, and as a result, you need to follow this policy? Chairman, in fact, we have been adopting the 20% over the years. We need to recover some of the costs, and at the same time, we do not want the increase to deter people from making applications for adoption. Mr. Fernando Zhang, concerning fees, I agree with Mr. Chen Chi-chun. I don't think there is a need to apply the users pay principle or the cost recovery principle here. Families applying to adopt children love children. They feel that the experience will be very rewarding, and at the same time, in fact, they are doing society good. They are taking care of these children. In fact, it would be best if children are adopted before they reach the age of 6. There are so children who are waiting to be adopted. In fact, they can satisfy all the relevant criteria. And I think the SWD always acts very carefully in adoption cases. What I mean is, if the surviving parents have not indicated categorically that they wish to relinquish their children, then adoption will not be arranged. You can see that so in some cases, the father may have passed away, and the mother doesn't go to visit him. But yet the mother has not indicated that she wants to relinquish the child. So children in such conditions are caught in the middle. They can't be adopted, and then they reach the age of 18 and have to be on their own. The proposed increase in fees is not too big, but I think we should try to perfect the adoption arrangements. Now, at the moment, some children are under foster care, and then when they grow older, they may have to be moved from one family to another one. And even if the foster parents want to adopt the children, they may not succeed. So concerning foster care services, adoption services, and also children's homes, I hope that there can be a review of this of such services. Yes, we'll have to look at adoption services and foster care services in detail. Yes, we hope that the whole spectrum of services can be studied and reviewed. There are, I think there are children who are not visited by their parents for a year or two or even longer, and foster care and adoption can be arranged for them. How many children are there at the moment? I don't have the figures here with me, Chairman, but I want to say that our social workers do formulate long-term care plans for the children. If the social worker thinks that the child is suitable for adoption, then he will make the necessary arrangements. In considering adoption, we take into account many factors, and our main concern is the welfare and benefit of the child. And in fact, in some cases, we can go to the court to obtain an order so that the child can be adopted. Now, when we go to court, the court will ask us many detailed questions, because the court will not deprive parents of their rights to the children lightly. But I want to say that we always act in the best interests of the child. It's true that some parents may not visit their children for a long period of time, but then they may not relinquish their children. Our social workers have to do a lot of investigation, and then they submit reports to the courts, and the courts can, under the adoption ordinance, order that the children can be adopted. But we want to know how many such orders have been handed down by the courts. I just want to tell members that we do not need to indicate our preference as to whether it should be A or B. But the chairman, I really hope that members can give us some indication of their inclination. 2 members have said that they prefer option B, and no members who have spoken say they prefer option A. I don't think we can really come to a decision of the panel because we don't have enough members. Right, thank you, Ms. Chair. Thank you, Mr. Fong. Let's move on to agenda item number 5. Pilot scheme on residential care service vouchers for the elderly. And we have paper CB 277006 and also paper 07.
Please invite representatives from the administration to join us. We have quite a big team from the administration. Ms. Annie Tam, Permanent Secretary for Labour and Welfare. Dr. Ernest Choi, Principal Investigator, and Dr. C.K. Law, Principal Investigator from the consultant team, Mr. David Jiang, Deputy Secretary for Labour and Welfare, Mr. Steve Z, PAS for Labour and Welfare, Ms. Cecilia Lee, Assistant Director of Social Welfare, and Mr. Moy Kun, Assistant Director of Social Welfare. Well, we have just overrun by a very short margin. So can you give us a brief introduction to the paper? Yes, I'll be very succinct to leave more time for members' discussion. Thank you, Chairman. This morning we're here to introduce to members the pilot scheme on residential care service voucher for the elderly. In his policy address 2014, the Chief Executive announced that he was going to ask EC to conduct a feasibility study on introducing an LCS voucher scheme in a year's time. And we're very grateful to the Elderly Commission, which has tasked its working group on long-term care model to take forward the feasibility study and to engage consultants. And they have commissioned a consultant team led by 2 professors from the Department of Social Welfare, Social Work and Social Administration of the University of Hong Kong, and the consultants will start their work and will start as public engagement exercise. We are very happy this morning to have the consultant team here to brief members on how they're going to proceed. Dr. Choi and Dr. Law are going to give a PowerPoint presentation. Thank you. Because of time constraints, I will be as brief as possible in my PowerPoint presentation. Well, starting from August last year, speakers off mic. Can you please give us a hard copy of your PowerPoint presentation? Because we don't have it. We may not be able to photocopy it in time for this meeting. Can we first have the briefing first? Okay, thank you. Preliminary findings. And also our a preliminary feasibility assessment and also conclusions. We have studied experience in different jurisdictions in the provision of vouchers. So we have studied the experience and also various data, and we've also discussed with focus groups and stakeholders, and we've come up with some preliminary possible options. We have surveyed 295 elderly persons on the central waiting list and also their family members, and we have already analyzed 600 feedbacks received. We've issued over 600 questionnaires to contractors operating non-subsidized RCHs. 300 odd questionnaires have been returned, and our report will be based on information from over 200 questionnaires. And so our preliminary findings. We've polled 600 odd persons, and about 30% of them are willing to accept this RCS voucher arrangement. For those already living in RCHs, they are more inclined to use the voucher scheme, and the percentage is lower, only about 1/4 for those living at home, whereas for those living in RCHs already, half of them are willing to accept the voucher scheme. We asked will they accept if there is a means test. About 10% of them are willing to accept a means test. About 16% of them are were not able to decide whether they would accept this arrangement, but they said that they would consider the scheme if their conditions changed. So these 16.9% may be willing to accept in the future. And we've also asked about co-payment. Even in the current arrangement, there is already a co-payment arrangement. It can be in the form of a fixed rate, and there can be a sliding scale depending on the financial situation of the service users. 31% and 61% accept a fixed rate and sliding scale respectively. They hope that by a payment arrangement, they can have top-up services. We've polled CSSA and non-CSSA elders. Non-CSSA elders, 77% accepted this, and 45% of the CSSA elders accepted top-up services. About 44% of the elders were willing to leave the CSSA net if they could be given vouchers. And we also asked the wish of operators. There are 5 types of operators. Of course, different types of operators have different inclinations. For those providing A1 grade places, 91% were interested, and so on and so forth. Based on the response of these 200 odd operators from a supply point of view, I think there are suitable conditions for implementing the scheme. There are other considerations. Those with a shorter waiting time were more inclined to accept the voucher scheme. If they have been on the waiting list longer, perhaps they think that they will be granted a place quite soon. And then as at October 2014, there were 24,000 odd elders on the waiting list using the acceptance rate of 10%. We believe about 2,400 elders would be interested in accepting the voucher scheme. And according to SWT, in 2014, there were 14,000 new cases using the same ratio of 10% to project. Every year, there will be another 1,400 new cases willing to accept the voucher scheme. There should be a certain level of demand. So we believe there should be some interest for the voucher scheme. So are there other considerations for the desirability and feasibility of this scheme? Now, we have other voucher schemes in Hong Kong. The biggest merits is to offer more choice for our consumers, and service providers will then have the fiscal incentive to raise their quality of service, and this will attract more operators to the industry. So we believe there are both incentives for service users and providers, and people may have different affordability, and this is a way to ensure fairness. If more elders have adopted the voucher scheme, that means it will be a shorter waiting list for those waiting for subsidized places. Of course, there are bound to be demerits. We believe some part of the voucher may be an incentive for institutions to mark up their prices. And this may also be an incentive for elders to move into an RCH prematurely because of the voucher scheme. We hope that the implementation details can address these demerits. We have assessed the situation locally and overseas, and we've come up with the following recommendations in 7 areas in the main. First, if we are to implement the voucher scheme, we should not just select pilot places. Rather, it should be made available to all 18 districts because we have 500 odd private homes and also other operators providing non-subsidized places. Most of them have preference for a particular district. So we suggest that the pilot scheme should cover all 18 districts. To ensure service quality, we hope that the contractors should be providing a level of service comparable to the enhanced board place scheme. There are standards, and the value of a voucher should use the cost for an enhanced board place scheme for reference. If elders on the waiting list have severe physical disabilities, then after the central assessment, we suggest that extra supplements should be granted so that the elder concerned can continue to use the service without hospitalization. I think on other occasions you're aware of a case management model. We hope that the service users can then make informed choices. They should be informed of the core services available from different RCHs. So there should be a cooling off period. Elders should be taken to visits to different RCHs, and there should be a service platform set up. We understand that some elders may not be very conversant with IT, but their family members can make use of that platform to understand the range of services available. So we propose a 6-month cooling off period. But elders will go to see different RCHs, and if the elderly person desires to choose a particular RCHE at a 6 month, we will ask the operator concerned to give an extra month as a cooling period. So it will be 6 plus 1 month. We have different types of services, CNA homes and nursing homes. I think we should start with CNA homes for the pilot scheme.
So, as I have pointed out, there will be a cooling off period. During the 6-month period, the case manager will help the elderly person make a choice. But then after the cooling off period, if the elderly person decides not to make use of the voucher and his conditions allow him to age in place, then they will revert back to the category of users of community care vouchers. Now, if an elderly person has already made use of the residential care service voucher, he will leave the queue. But then, if after the cooling off period he still wants to apply, wait for a subsidized place, and he will go back to the central queue. So we will try to safeguard his interests. And then for the value of the voucher, we make reference to the unit cost under A1 class hostels, and it's about $11,000, $11,685. And depending on the means of the service user and taking into account his for affordability, will work out a co-payment arrangement, and there will also be a top-up payment arrangement. In fact, you can see that there is a lot of information in this table, but I want to say that for the lowest row, 0, then there will be there will be a full subsidy, and we encourage elderly persons who have the means to pay more. For level 7, there will also be a government subsidy, but we hope that the elderly person concerned can shoulder 75% of the amount. So in fact, is to make sure that those who can afford it can pay more. We understand that elderly persons also need to spend money on consumables like diapers, and they may need special diet arrangements. And there is a care supplement provided to CSSA recipients. And then coming to the means test, the elderly person will be assessed as a singleton, and then we will assess his income and his assets at level 0. That's the CSSA level, and so we will make reference to the asset limit for singleton CSSA elderly recipients. And then for levels 1 to 6, we will make reference to the asset cap for single elderly persons applying for PRX units. In other words, about $440,000. For a single elderly person, he gets about $7,000 a month as CSSA payment, but under the scheme, he will get about $11,000, And as we do not allow double benefits, the elderly person will have to be taken away from the CSSA net. CSSA recipients do receive waivers or concessions when they attend public hospitals or clinics, and so there will also be similar arrangements under this scheme. And elderly persons or their family members may be willing to pay more for better services. For example, upgrading of the room from a 4P to a 2P room, or having some special meal arrangements. That's the top-up arrangement. And so for the top-up arrangement, there is a cap, and that's about 75%. So in other words, the cap is $20,449. This is because we want to make sure that the vouchers will be given to those with the greatest need. Well, there will be a quality assurance mechanism. There will be inspections. People can lodge complaints. And if service providers cannot provide a satisfactory service and the service users feel aggrieved, they can lodge complaints. And the government will also enter into service agreements with service providers. Penalties include warnings or disqualification of the service provider under the scheme. And we, as the Permanent Secretary has pointed out, we hope to have views from the community and also service users. On Wednesday this week and on Saturday this week, we'll be meeting service users, service providers. So there will be 2 public engagement sessions in this week to try to get their feedback. Thank you. Right, members? I think the end time will have to be extended from 12:55 to 1:10. Right, each member will have 4 minutes. Dr. Fernando Zhang. Thank you, Chairman. I think the information should have been given to us before the meeting. The paper issued to us before the meeting contains only 1.5 pages. There is little content in the paper, and you should have given us all the substantial information before the meeting. I wasn't able to jot down all the figures. We were not in the know. You did surveys, you carried out studies, and then you gave us such a lot of information in a PowerPoint presentation. How can we have a meaningful discussion? We're not talking about state secrets here. We are just talking about residential care service vouchers for the elderly. Why were you so secretive? Why did you not give the information to us well before the meeting? We're talking about a major change to the mode of service delivery. It's true that it's only a pilot scheme, but still, I want to say this. We are told that about 10% of the elderly persons are willing to consider adopting this option. So my impression is that interested service providers are bought place homes, A1 or A2, but then they only account for a minority of the homes in Hong Kong, and the amount will be increased from about 9,000 to about 10,000, all right, roughly speaking. I know that you hope that the quality can be enhanced with the increase in the amount. I want to say that the quality of services provided by bought place homes is worse than the quality of services at subsidized or subvented homes. May I refer you to the Director of Audit's report number 63, and you can see that there is quite a big discrepancy between the services provided by bought place homes and the services provided by subvented homes. So are you going to in the future rely very heavily on bought place homes? And then there are about 30,000 elderly persons on the waiting list. And as at the end of March 2014, only 5% of the elderly persons on the list were willing to consider bought place homes. Most of them did not prefer bought place homes. They preferred subvented homes. And so if you are to rely more and more heavily on bought place homes in the future for the provision of residential care services for the elderly, then I am really rather worried. Now, I think it's good that when you carry out the means test, you will not consider the income of the entire family, but also the income of the elderly person. In my view, you should do away with the means test. In fact, most of those on the queue are CSSA recipients. So out of the 1,000 odd places, how many will be at level 0? How many above 0? I don't think they have time to give answers. Let them reply later. And I want to ask the Permanent Secretary this question also. That is why why haven't you given us the information before the meeting? I need to apologize to members. Maybe there was some not very good communication between our colleagues and the Secretariat. We'll try to do a better job next time. Mr. Tang, please give him the mic. Please give him the microphone. Please give Mr. Tang Kapiu the microphone. Please, those. Okay, can you try again, Mr. Tang Kapiu? Please switch on his mic. Technicians. No, I really don't know how to discuss this matter. The paper finally arrived last Friday. It contained only 1.5 pages. And we were only given some a macro account. I want to tell you that worries have been expressed. For the community care vouchers, the quota has been taken up after a lot of promotion. But then the organizations have complained that the $5,000 are not enough to provide a really good service for the elderly. And now you are launching this residential care service voucher scheme. And the amount will be about $10,000. And as a result, organizations feel very frustrated. They in fact want to do a better job to improve upon the community care service provided to elderly persons. But then they will have to spend a lot of time studying and preparing for this new pilot scheme on RCS. So I think you should be fair to all those concerned. There are organizations covered by the community care voucher scheme. They face a lot of uncertainty. Elderly persons may switch to other organizations. And if you launch this pilot scheme with an amount of $10,000, organizations will not be willing to provide better quality community care service anymore. Elderly persons may want to try this pilot scheme. Do you know that for those now on the waiting list, if they are willing to go to a birthplace home, the waiting time will only be about 6 months. So do you think this pilot scheme will really be able to help the elderly persons? And then for birthplace homes which have a good reputation, can you ask them to provide more places? And my greatest worry is that organizations will no longer be interested to improve upon their community care service for the elderly.
We just saw the PowerPoint. Now it's hard for us to have an in-depth discussion. So, Mr. Chairman, how are you going to proceed? Should we have another meeting on this, or let's have a very thorough discussion this afternoon? Now, for those waiting for a place, they have different thinking. But for those who have been hospitalized for 3 to 4 months after a major disease, well, they can't be taken care of at home, and they are those in the great in dire need of services. Can you cover these first? Your time is up. I'd like to tell Mr. Tan Ka-Piu that we've already decided at the start of this meeting, many deputations would like to give us their views, so we're going to arrange a public hearing in early March. Rather than that by then, there will be a more thorough discussion. Mr. Chairman, I think Mr. Tang has raised an issue. Well, we're given 1.5 pages from the administration, and it's close to nothing. And then the consultant team were not able to catch up with the information they gave us in that presentation. Now, I'd like to ask about the objectives of residential care. I'd like to ask the administration, what problems do you address by means of this RCS voucher scheme? You have 4.5 minutes. P.S. The reason why the administration wanted to have a pilot study, this is because the waiting list is very long, over 30,000 on the waiting list, and the waiting time ranges from 20 or to 30 months. And other than subsidized RCHs, we have private homes. They account for about 30%, or rather their vacancy rate is over 30%. In private homes, about 70% of them are CSSA recipients. And I'd like to respond to what Dr. Fernando Zhang said. They only receive $6,000 odd. And we discovered that many private homes would pack their level of services to this $6,000 odd. So many elders living in private LCGs are only getting services valued at $6,000 odd. Of course, there is some discrepancy in service between this and subsidized homes, and there is little incentive for private homes to improve their quality of service because they will live within this budget of $6,000 odd. In the long term, we have to ensure that there is sustainable and sufficient residential care services for the elderly. So there may be different modes of provision, one of which is RCS voucher scheme. We give money to the elderly to choose the kind of or the level of service they want. The value will be over our CSSA level. For those receiving CSSAs, even if they have some means, they cannot top up the services. All right, you spend 2 odd minutes. I get the point now. Now, if the objective of the scheme is to address co-payment by CSSA recipients, I can see this point, but you talk about improving the central waiting list. However, those on central waiting list must have some form of physical disabilities. So how far should private homes under the bought place schemes be improved? So I want you to have priorities. If the priority aim of the voucher scheme is to address co-payment by CSSA recipients, it sounds attractive. But if you are talking about addressing or shortening the central waiting list, I don't believe this scheme can be useful. All right, I talked about CSSA recipients. How is this scheme going to help the central waiting list for elders that they can afford private homes? They can top up what they get from the voucher scheme to a service level equivalent to $20,000 odd per month. Perhaps that is the kind of service standard expected by elders from the middle class. Now, if they can top up this voucher to $20,000 odd, then they don't have to be on the waiting list. Then I have to address this problem. Competition between grassroots and elderly that can afford better services. So even if you release all the private homes, that won't be too helpful. So there is still competition before the have and the have-nots. So you have to sort out what exactly are you addressing using this scheme. If there is time, perhaps the two scholars in the consultant team can supplement. I think both can be done at the same time. Because a private home can provide different levels of service. There are also self-sufficient LCGs. They are not private homes. They can offer such services by means of non-subsidized places. We allow the two doctors to share their views with you. I think we'll give some time to the two doctors later. Mr. Lang Kwok Hong. It's always like this with government policies. They want to gradually private such services at the expense of the have-nots. This is a very simple logic. Your system have made it very difficult for the have-nots. I'm talking about the CSSA recipients, their family members would like to help the CSSA recipient. However, they are bound by the rules of CSSA. If you want to address it, it is very easy. You just change the rules. For those on CSSA, if the government cannot pay for quality services, then their children, their adult children, should help. Now, if it is either CSSA or financial support from their family members, then of course people will never go for the latter. They always want CSSA. And in the private sector, you're helping the haves to procure better services. Of course, you may not be really doing it at the expense of the have-nots. Still, you are helping the haves to squeeze out the have-nots. Hong Kong, well, it's simple. You like to say that we don't have enough land. It is the government's. It is up to the government to give land for building more RCHs. You have the Town Planning Board. I am strongly against this RCS voucher scheme. All sorts of voucher scheme is stupid, even in education. You say that the middle class has paid a lot of taxes, and if the children face education problems, you should top up the expenses. So you give them $4,000 so they can afford $14,000 per month for their kids' education. This is silly. Those who have the means can procure the services based on their financial strength. The problem is the poor elders in Hong Kong cannot take care of themselves. So why don't you spend resources to help them first? This is a matter of policy. So Hong Kong people are so stupid. There is pre-screening for C candidates. So people with other political platforms cannot join the race. And the same logic applies to transport policies. So we've fattened the railway system, and the railway company has squeezed out other modes of public transport. I fail to understand. Do we have two doctors here? Can the two doctors help? What is the rationale behind the scheme? So you should give time for the doctors to reply. The PS should reply first. I never imagined that doctors could think this way. PS. The pilot scheme is not just meant for helping the affluent, because regardless of your means, you can be on the central waiting list. Now, we want to try a scheme where CSSA recipients can benefit, and those who can afford it can enjoy services valued at about $2,000 more or less. So we are not using this pilot scheme to benefit the rich in particular. I beg your pardon, this government official, you don't have enough land to build RCHs. If the Town Planning Board can approve more sites for building RCHs, you should focus on this. This is not just about how much money people are paying for the services. Your time is up, Mr. Leung Kwok Hong. It's my turn. Yes, I agree to this consultancy. In April, last year, we supported this consultancy based on the premises that we should think of ways to address the long waiting time. I think the scope of the study was given by the administration to the consultant team. I think they have overlooked the fact that the avail in the voucher scheme will be limited. As said by Mr. Tankapiu, you have not considered this. It's just like earlier on in the meeting, we asked the administration how come 100 places are provided in each of these 12 sites, which the administration took pains to identify. Is a waste of money. Of course, what you propose here we welcome, but perhaps your scope is not wide enough. You have failed to address the real issue. When I met Hong Kong CSS last week, I was asked what would be the situation once this is introduced, then the community care voucher scheme would not be popular anymore. I know you're trying to absorb people who have some means under your voucher scheme. Besides, how are you going to regulate the services of private homes? You have not regulated them properly, and yet you are giving them so many more new clients. So I like to say this to the consultants.
A decade ago, we saw cases of abuse of elderly persons in private homes. So how can we be not worried? Permanent Secretary, well, I really hope that you can address all these concerns. Yes, thank you, Chairman. Last time, members agreed to support the creation of a directorate post to serve as the Elderly Commission. I want to say that there will not be duplication between the two schemes. One scheme is on community care services, another scheme is on residential care services. I know some elderly persons use community care services while they are waiting for residential care services. And of course, we're concerned about any impact on the new scheme, on the earlier scheme. We don't want to see unintended consequences. We don't want to make elderly persons enter residential care homes prematurely. That's why we hired a consultant to help us study all the relevant matters. We have to make the elderly persons understand that they need to make an informed choice between the two options. Now, for the RCS voucher, the amount of payment is bigger than the amount under the community care service voucher. But then the cost of residential care service is, of course, higher. And so the homes should not only just look at the absolute amount. And some NGOs operate subsidized as well as non-subsidized places. But I think we will step up monitoring across the board. Right? If members have, if there is sufficient time, then you can invite the two doctors to supplement, Chairman. Mr. Fernando Zhang. I'm not talking about the quality of service provided by private homes or subvented homes. I'm talking about unit cost. Last year, 9,506. Now 11,800, up 23%. In other words, and this is by no means a small increase. But then, before we had the $9,500. In fact, that was this 20% increase to $9,500. And then unit costs for subvented homes, unit $14,000, and then nursing homes up to $20,000. The CSSA payment is only about $6,000. Enhanced bought place $9,000 odd, and then subvented homes $14,000, nursing homes $20,000. So you can see why the quality of service is different. Enhanced bought place homes are in fact private homes. They are of course better than homes that have not taken part in the scheme, but then the hardware has its limits. In fact, you are in effect increasing the unit cost for enhanced bought place homes. In future, if there is any great impact, or if you think there will be any great impact on the demand, I don't think that's going to happen in the foreseeable future. You're just using these vouchers to improve upon the bought place scheme, but then you've introduced this major concept of means testing. So in future, for community care vouchers, residential care vouchers, there will be means testing, and I'm worried that means testing may be extended to cover subvented homes as well, and that's my greatest worry. Is this your intention? A permanent secretary. Chairman, we hope to achieve a few things under this present pilot scheme. We hope to see services to elderly persons improved, especially CSSA recipients in private homes. And second, we hope to try to increase the number of places available. Now we have places available in some private homes, but at the same time we have a long queue for subvented homes. And then we are trying to experiment with the top up and with the co-payment arrangements. We want to experiment with these concepts, whether they are in fact feasible in Hong Kong, and I think this is important if we want to ascertain the sustainability of our services. At this stage, we have already said that this scheme will not affect our commitment in other areas like identifying land for subsidized or subvented homes. Your time's up. I think I'll give you time for the third round. Mr. Leung Ko Hong, I don't understand your logic. Do you know who are in the greatest need for the service? Those who are poor, no doubt. You want the money to follow the people so that they can buy the service, but you have to. But then these people must be able to have the means to buy the service. You have to help the poor. You let the permanent secretary answer your question. I want to finish first. You want people to get the service while paying less. In fact, elderly persons in Hong Kong will not buy private sector service if they can have easy access to daycare units or other services. I think you've got it wrong. You need to help the poor. So you need to make sure that the price is low and affordable. Yes, perhaps I can invite Dr. Law to give a reply. Chairman, I think Mr. Leung's question is related to an earlier question raised by Dr. Fernando Zhang. Dr. Zhang asked how many were at level 0. I think about 70 to 80% should be at level 0. Mr. Leung is saying that 70 to 80% of the prospective users of the vouchers are on CSSA, and so and then for the richer people, they can still queue up for subvented homes, and they can just pay about $1,000 to $2,000 for subvented homes. Now, I think we have to look at a few factors in parallel. We have the $11,000, which is the value of the voucher, and then there is the maximum top up of about $8,000 odd. So for those who are very rich, now there are now places in the market costing over $20,000 up to $40,000 or $50,000, but then the vouchers will not allow them to get the so-called luxury services. And if they take up the vouchers, they have to pay $7,000 to $8,000 themselves. But at the moment, they only need to pay $1,000 odd, less than $2,000. So this scheme is not designed for the rich. On the contrary, the voucher is for those, say, who have retirement benefits. They will have to pay $5,000 odd more each month instead of merely paying the sums that they are paying at the moment. Mr. Chang Kwok-chi. Chairman, I want to ask the team this question. With this pilot scheme, by how much can the queue be shortened? And then with co-payment, then does it mean that we'll no longer have the so-called abandoning the parents' certificates under the CSSA scheme? Now, Chairman, these persons on CSSA, they are queuing up. And then on the other hand, there are people queuing up, they are on CSSA, they are now in private homes, so they are on the central waiting register. And there should be about 10 to 20% of them in this latter category. For those on CSSA, now in private homes, queuing up for subvented homes, we, under this pilot scheme, can help them get immediate improvements. With the vouchers, they can go to a private home providing better quality services, and they may not choose private homes, they may go to self-financing homes operated by NGOs, and they may also choose non-subsidized places and contract homes under the voucher scheme. So we can kill two birds with one stone. We can shorten the queue, and then we can also help those on CSSA in private homes now queuing up. But then if people, if elderly persons do not suffer from moderate impairments, they won't be given subsidized places at all. So they only those with medium level impairment or a high level of impairment will be covered. Is that right? Because they're not queuing up, but then they want the right to choose. I believe you're talking about those who have been assessed by the central assessment mechanism, and they are now in private homes. But then we are not covering them. In fact, you may ask whether those in subsidized homes can also join this pilot scheme.
But the person can make use of the voucher to live in a non-subsidized place of a subsidized home because he doesn't like the private home he is staying in. Well, so far we have not received this possibility. Well, there is this possibility. A person may ask whether this is allowed, and you have to address this issue. All right, we will. We are now just sharing with you our preliminary findings. This is going to happen, I think. By the time the scheme is launched, I think people will think about this. We have only got 2 minutes for Dr. Fernando Zhang. We have to end by 1:10. Well, I think subsidized homes are not too interested. They are getting a unit cost of $14,000 or $20,000, and here I think for people who like to live in subsidized homes, they won't be interested in this scheme. My greatest worry is, well, you may call that a conspiracy theory. Once a means test is introduced, they may do the same for subsidized homes. And if in the future subsidized homes are forced to adopt the voucher scheme for its operation, then in the future the subsidized homes may tell elders that here the service of the unit cost is $15,000 or $18,000, and you have to top up. Your question is clear. The mic is not on. All right. The mic is on. It's not that people are not interested. They are not too interested because they don't have much room to do so now. For non-subsidized places, they are not charging $40,000 per head. There is a range. In some government-organized non-subsidized places, they may be charging $21,000. So it's not that they are not interested, but it's certainly not high. And Dr. Fernando Zhang asked about the unit cost. You mentioned the figure in budget. They have covered both A1 and A2 homes. We want to raise the standard to A1 level. For A2, the level is not $9,000, is lower. And if A2 homes are willing to raise their quality of service, then or standard of service, then they will be eligible under the scheme. So one intention is to encourage A2 homes to upgrade their level of service to A1 level. Oh, thank you very much, administration and members. I think today we had a very interesting interactive discussion. If we were given the PowerPoint presentation beforehand, it would have been much better. Anyway, in early March, we are going to convene a public hearing to meet deputations. We will also invite NGOs to attend. I hope the two doctors and the consultant team can also be present together with the administration so that we can all discuss this new idea. Thank you very much. Meeting adjourned. We're on time.